Hi everyone, and I welcome you to Haq Research Centre's Distinguished Lecture for June 2021. This is also the 75th session of LUMS Live. I'm not only welcoming you on behalf of Haq Research Centre, but also the Population Council, Zeba Sathar Gender Initiatives, Centre for Economic Research Pakistan, Institute of Development and Economic Alternatives, Institute of Development Studies at Sussex, and the Consortium for Development Policy Research. My name is Maha Rehman, and I'm the Director Policy at Haq Research Centre, as well as the Adjunct Faculty Member at LUMS Economics Department. I will be moderating today's discussion along with my colleague, Dr. Hadia, who is an Associate Professor of Economics and the Director of Zeba Sathar Gender Initiative at LUMS. The aim of MHRC's Distinguished Lecture Series is to provide an opportunity to learn from the work of leading scholars on 21st century global and regional challenges. I'm incredibly honored to welcome Dr. Zeba Sathar today. Dr. Zeba is the Director of Population Council Pakistan and is a leading demographer working on South Asia. Her research interests include demographics, gender, population planning, and child and maternal health. She's the author of the publication Capturing the Demographic Dividend in Pakistan. In 2006, Dr. Zeba received the Tamgha Imtiaz from the President of Pakistan in recognition of her public service. We are incredibly honored to have Dr. Zeba with us today. I'm now going to ask Dr. Hadia to frame today's talk briefly before handing over the floor to Dr. Zeba.
Thank you, Maha. Assalamu alaikum, everyone. So the talk today is about Pakistan's fertility rate. And in that, when we start looking at Pakistan's fertility rate, we realize very quickly that it diverges sharply from that of the rest of South Asia. So just to give you a little bit of and Dr. Zeba is going to be showing us some very interesting graphics about this. We overtook Brazil and became the 5th most populous country in the world in 2020. And at the current fertility rate, per the UN estimates, so why have we failed to reduce our fertility rates when our neighbors have been more successful? And is our fertility rate problem, is it really a problem or is it a boon? High rates of population growth may result in what we call a demographic dividend, where a youth bulge could be leveraged to spur growth and innovation. On the flip side, if high rates of population growth are not matched by a concurrent growth in resources, we see the latter come under immense pressure, resulting in marginalized groups tend to suffer disproportionately. We are immensely privileged to have Dr. Sathar with us today, who will examine the reasons behind why Pakistan's fertility rates diverge from that of the rest of South Asia and the implications that this has for citizen welfare. Dr. Sathar, over to you.
Thank you very much. Thank you very much for that kind introduction, Maha, and to Hadia for framing this so well. It makes my task easier. But I'd like to begin by thanking Dr. Development Center, which I had the honor to work with Dr. Khadija Haq in earlier days. And also for focusing on this area, because we really move outside our communities, and this gives us an advantage to also learn from other people who might inform our analysis that we've been doing. I did want to say that the Population Council, of which I'm the country director, maybe I would start my first slide, but basically first of all, I want to thank Maqsood Sadiq for the quick analysis in the last 24 hours. He's put together most of my slides, and I borrowed some from Dr. John Bongartz, a very senior colleague, internationally famed demographer, who actually, he and I are working on the prospects of exactly what you talked about, replacement fertility that would lead to radically lower fertility by 2030. To start off with, if I can have the next slide, we do want to introduce ourselves because many of you may not know that the Population Council is basically a research organization. And this is our logo, Ideas, Evidence, Impact. We usually don't stop with the research. We use the evidence for and working with the government of Pakistan, the provincial governments to make that impact. Next, please. We have offices throughout the world, and as you can see, Pakistan is one of 13 country offices across the world. So this is a bit about, and I represent the Pakistan office. Next, please, Khalid. So I want to spend some time just laying out the context of what we're talking about. You framed it very well, Dr. Hadia, but I did want to go back and a little bit into the demographic transition theory, which actually demography has very few theories. And one of the basic theoretical premises that was established back in, I would say, in 1948 by somebody called Notstein, and then elaborated by Ansley Cole and other very, very well-known demographers, Van der Waal, etc., in the 80s. The theory was based basically on the European transition, demographic transition, which was much easier to understand. It had a classical face of high fertility, high mortality, high fertility, followed by a period of high lowering mortality at the end. This model seemed simple. It was good to follow. Latin America followed more or less the same pattern. And then along came South Asia. And South Asia is an outlier in the context of regions because everything was extremely heterogeneous in the South Asian context. And even I had to go back and look at something I wrote jointly with Jim Phillips, starting a book on fertility decline in Asia, that we had to explain really disparate situations even 20 years ago, leave alone now, where, for instance, despite similarities, we all followed, each country practically followed a different path. But the difference is that most countries, in fact, all the main South Asian countries have now converged. Pakistan hasn't. The other important takeaway is that everyone followed a very different speed, whereas the classical transition happens about 2 to 3 decades after mortality decline. In Bangladesh, fertility declined even while mortality was high. While in Pakistan, we've experienced mortality decline since the 60s, but we have yet to really have that genuine full fertility decline. So Pakistan, as you said in your introduction, appears to be in a way stagnating. Not appears to be, it is stagnating. And this is leading to unprecedented high intercensal growth rates. And the last one was 2.4%. And for the first time, the government got alarmed. And there was something called the CCR recommendations, which I would love to talk about, but I don't think we'll have time today, another time. The reason why the Supreme Court Chief Justice took notice was because, and others should have as well, actually, I'm surprised they didn't, particularly economists, planners, finance people, about the huge implications of this level of growth, albeit it is over 18 years, 2.4%, and it's probably less now, but it's still about double the levels of the rest of South Asia. So, I mean, basically, it is important, therefore, I think, and for us, it's exceedingly important to establish the divergence, to show it to policymakers, we're doing it to parliamentarians, academics, etc. But for the academics to really seek explanations of why. And I guess this is just, 45 minutes of doing that, hopefully. And so let me start next. So we all agreed to this title. In fact, Dr. Ali Chima came up with it, but the divergent fertility decline. Well, how divergent is it? Well, very obviously you said 3.4, but actually the Demographic Health Service place it at 3.6. This is the total fertility rate in 2017, whereas Bangladesh is almost, I think, closer to 1.9. And even Nepal, which was almost lumped with Pakistan about 15 years ago, has made up for lost time. So next, I just want to use this slide, which we used actually in the pre-symposium that was held in 2018, mainly for policymakers, but I think it depicts what happened in 1950. Let's say everyone, all these countries, including Indonesia, big one, but certainly Pakistan and Bangladesh are all lined up, at about a total fertility rate of between 6 and 7. We were closer to 7 then. But then almost every country had a population policy, and some implemented it better. Indonesia ran ahead, resembling the decline in Southeast Asia, and therefore having that advantage and implementing a very good program. But India wasn't far behind. So by 1980, differences emerged. But by 2010, next please. By 2010, we find that a whole lot of unexpected countries, Iran in particularly, outbeat everyone. But Bangladesh, of course, is the one that's been written about, analyzed and reanalyzed, and compared it repeatedly with Pakistan because of its similarities. And of course, we were part of the same country at some point. But it's the differences that made the difference, actually. But even Saudi Arabia, we put in Saudi Arabia, because everyone says, oh, Pakistan is an Islamic country. And I just want to get that explanation out of the way. With Saudi Arabia, through a private, not a very widely declared program, it's a private sector program, has managed to reduce its fertility. It's about 2.6 currently, in a very rapid way. So Iran, Bangladesh, Saudi Arabia, all Muslim countries speeding along. And what do we expect by 2045? Well, the UN in particular, we want it to be different, but this is what the UN predicts, that in 2045, we'll be the Lone Ranger. Perhaps we'll be followed on our side. We might even see Afghanistan taking off. But this is the situation that one predicts if we follow the current speed of fertility decline, which is hard to imagine because nothing has really changed. So what are the other divergent features of Pakistan's fertility decline? And I think Hadia pointed out that, first of all, I'll explain the framework that I use. It's borrowed from John Bongart's. It's an adaptation of the general analytical framework used by demographers. And it's a bit simplified, but it makes it easier to frame some of the slides that I'm going to come up with. You expect demographic transition theories, you expect socioeconomic development to reduce desired family size, increase the demand for contraception, and therefore increase contraceptive prevalence. And contraceptive prevalence is the main driver of fertility. On the other hand, on the supply side, you expect family planning programs, as were implemented in all of Asia, to alter to influence the implementations of preferences, not just through services, but also through mass media programs and other communication that actually influences declines in ideal family size, but desired family size. But look at their levels now. They're around 2 or even less than 2. Mean difference. Next. The second major difference is the low demand for contraception. So whereas we have something called unmet need, but we have very low demand for contraception. Basically, women are not turning to contraceptive methods, leave alone particularly not turning to modern contraceptive methods for the fertility transition, even when they say on survey after survey and in qualitative work that they're desperate to reduce their fertility. They reject in a way, modern contraception. They frequently turn, and a large proportion of our contraceptive mix is using withdrawal and other traditional methods, mainly, I think, due to safety reasons and fear of side effects. So divergence number 3, next, please, is, oh, sorry. Yeah, so sorry, I think I've confused. So I'd like to go back. Could I go back to divergence number 2? Demand for contraception, I went directly to contraceptive use, is the overall demand, which means that which is met and unmet. And as I start talking about the unmet demand is quite high in relative terms. But if you even include the met and the unmet, Pakistan comes out very low. It's above 70% and or 65 to 70% when you're reaching those levels of the end of the fertility transition. We actually, if you see the dip, there's been a dip in overall demand. So I'll skip the next slide because I it sort of, and then go to 4. So divergence number 4 is Pakistan after PhD, which is a long time ago, puzzled me and continues to puzzle. When I was there, Pakistan Institute of Development Economics, not much has been done on this, and we still, actually, it's even a greater puzzle than anything, because if you look at Bangladesh, now Bangladesh, 51% of women of ages 20 to 24 marrying before the age of 18. So despite low fertility, that is unchanging. In the case of Pakistan, only 18%. I know there are pockets of child marriage. We worry about it. We have laws against child marriage, but it's on the cusp around 18. It's not like 15. If I were to do the chart for 15, this would be even more exaggerated difference. So how did this come about? And the explanations, I mean, I think it deserves a seminar on its own. Next, divergence, but it does contribute to lower fertility. Perhaps the most anomalous of our findings, and we stumbled on this in our work, mainly research work on unmet need back in the late 90s, that women would not openly talk about abortions, but a lot of informal accounts seem to include accounts of abortion. And it was a challenge because traditional surveys do not measure abortion rates. And we used a very widely now utilized methodology by the Guttmacher Institute to actually measure the rate of abortion back in 2002, and it was alarming. It was 25, and we had about 900,000, estimated 900,000 abortions. Well, back in 2012, when we went back, this rate had doubled to 50%, and there were 2.2 induced abortions annually happening in Pakistan. And as you can see by the same methodology used in these countries, that this is higher than Bangladesh and higher even than India, where in India in particular, it is legalized, abortion is legalized. Another anomalous finding. So now I think I'd like to move on to look for explanations, because really just telling you what it is probably known by many of you. So as we go back to our traditional explanation of development, well, Maqsood, I asked him to pick 3 indicators classically used to measure overall development, or let's say infrastructure development: sanitation, electricity, urbanization. You can see that Pakistan scores fairly highly on all, and has done. In fact, the differences were even more, they've diminished. I mean, I think Pakistan was ahead of the curve in these particular development, infrastructural development early on as well. Next, the GDP per capita is another story. This has preoccupied and taken up a lot of the media discussion, of course, about what has Bangladesh done. First in 2018 or so, they surpassed the per capita income of Pakistan. It doesn't show up so clearly here. And now they seem to have surpassed the per capita income of India. So what is Bangladesh doing right, etc. But even Nepal, a poor country like Nepal, is catching up with Pakistan. And yet there is very little discussion, and there used to be much more discussion I remember discussion while Dr. late Mahbub Haq was alive, and even later, about the importance of population trends and the concern for them, but there's no concern at all. Even in all the media conversation, discussions, and op-eds, you hardly see mention, everyone mentions population growth rate, but it's a major factor contributing to, because you obviously divide GDP growth numbers, GDP, overall GDP by numbers of people. It's automatic, it's a no-brainer. But I think it also affects other things in terms of productivity, etc., which we won't be able to cover today. But why does that matter? Does it matter? Not really, actually, because GDP is fairly similar across the region. It's not that we're not including China, which has a much higher GDP. Up to now, okay, there are differences that we scream about, but they're not huge differences. But does it make a difference to contraceptive prevalence or to fertility? No, basically no. If you look at that, there is a line drawn by the computer that there is no great association. There are too many outliers to call this any sort of line of association. And this is true for throughout the world. If you look within regions, you see these divergences. If you look perhaps across regions, then of course you will get this relationship with GDP, because we know regionally there are wide divergences across regions, and fertility decline does seem to follow overall development levels, which are close to GDP. But the individual countries, it doesn't really. Look at Bangladesh, where it is on the curve, etc. So next. If you look at human development, and I felt obliged to bring this slide in because we're grateful to, again, the Mahbub Haq Center for really highlighting human development issues in South Asia and across the world, actually, by introducing this Human Development Index. If you plot the Human Development Index, then you see that Pakistan, everyone seemed to be very similar, but then look how low we are ranked now. We are ranked low. Again, rather than comparing with Bangladesh, now I'm having to compare Pakistan with Nepal, and that's sad because I think given our level of resources. Next, if we break that up into what I think is a really, if you were to ask me what is a key indicator of a society and how well or badly it's doing, I would say one should really pick it's not as GDP, but certainly I would say education. But the second most important for me would be childhood mortality. How well are we doing in terms of childhood survival? And I think here again is another failure. I think we failed with education, but look at what we're doing with childhood mortality. Neonatal mortality is death within the first year of life. We're as high as 42, double of Nepal. Infant mortality deaths within 1 year, we are double of Bangladesh. And by the time we reach under 5 mortality, I mean, we are 50% higher. It's cumulative, so it's about 50% higher than the rest of South Asia. And that childhood mortality and child survival does affect, in a way, the mindset when people make up their minds about how many children they do have at the back of their mind, child survival. So that's an important point to keep in mind. But one that I think I want to particularly highlight is the next comparison, which is a comparison of women's autonomy, because in South Asia, the topic has not been discussed or researched as much as anywhere else. And again, if there was more time, I would love to bring out a comparison that I made with a colleague of mine, Shireen Jijiboy, across North-South India. And there were as many differences in women's autonomy across North and South India as there were in across Pakistan. But if you look at the aggregate, which is now even given that much importance that it's included in the World Bank data, I was surprised. Women participating in 3 pretty ordinary decisions: their own healthcare, major household purchases, and whether they can visit their family, their own family. And again, Pakistan, 36%, India, despite, as I said, the North-South India difference, 63%, and Bangladesh much higher. So women, I think, largely to deal with mobility, I would say. Mobility is also another important thing that we should bring in, because it does affect everything, access to education and the distance to travel and security, it's linked with security and distance issues. So maybe later, maybe in other studies, we should bring that out. And next. So in a region where we've already discussed women's autonomy is pretty weak, we're amongst the weakest. But what leads to empowerment of women? Where are we losing out on the empowerment? Is it, I've already highlighted mobility. Is it really that we have, sorry, no, again, I've skipped one slide. So let me just, so is autonomy important? Yes, it is. I mean, it has a closer relationship than GDP, for instance, and many other variables this is just a broad association, not controlling for anything, but between contraceptive prevalence. So but the outliers are interesting. Bangladesh and Nepal coming out higher, Pakistan, Afghanistan coming out low. And then with total fertility rate as well, Pakistan coming out higher and Bangladesh low. So it's not a perfect fit, and we've done a lot of work on this. So, but I didn't have time. I just want to say that it's important, but not the explanation for our lagging, lagging fertility. Next. And two sources of empowerment, perhaps measured in this way, literacy. And I think we really need to focus more on post-secondary education to really look for important drivers of fertility change. How many women in the society have post-secondary? Very few. And literacy maybe has improved, but that last secondary, post-secondary education has hardly improved. And female labor force participation. I mean, I've never seen such a flat curve as I have of female labor force participation rate. And I know it undercounts unpaid work and informal work, et cetera, but all the research that at least I've seen relates lower fertility and higher contraception really to work outside the home that's paid. Even if it's paid very little, it makes a big difference. Therefore, as I refer to mobility and mobility of women, if they curtail, they really influence all these indirectly very much. So now I'm coming towards the end of what I have to say. And sorry, before I do that, so there is a strong relationship. You throw in any education measure, and here we've just thrown in adult literacy and female adult literacy, and look at the strong relationship. And there isn't with female labor force participation rate, because you economists have studied this better, and not you economists have studied, and many people, and it is an issue of when you enter the labor, it has to be, you can't use cross-sectional data, you have to use time series. There are issues of causality, and of course, women who are in the labor force are more likely, that might be a cause for higher contraceptive use. So there are different patterns, but this is what the aggregate picture looks like. So as I said, now coming to I think one of the maybe most critical explanations is what we've been really advocating for the last, now very, very loudly for the last 15, 20 years, that Pakistan claims that it has a population policy on paper. We claim we have the oldest family planning program in Asia. We claim so many things, but effectively, our family planning program is performing very, very badly. And even in 2017, we find the green bar, which is Pakistan, doesn't, well, the aggregate number at the very end, which is shaded, the total index, is 52% compared to Nepal doing so well at 83 and the others at about 63. But in particular areas, we don't do badly in strategy, but look how badly we do with quality, and especially with equity. I don't think Bangladesh does that well with equity as well, but Pakistan does particularly bad, and with accountability. This is something that we are really working with task forces and federal and provincial task forces, and with better use of data to really combat now. So to conclude, sorry, no, one more slide. I have more slides than I anticipated, but it's a no-brainer again that there is a very close relationship linear relationship almost with the family planning index and contraception. Not so with the FPA index, not so much with total fertility, because total fertility is also influenced by abortions, by marriage patterns, and a whole host of factors. But contraceptive prevalence is definitely affected directly with the level of family planning program effort, particularly public sector programs. Even if there's private sector programs, and it leads to issues of equity, etc. So you have to have a good, solid program, which entails a good mass communication, interpersonal communication, services, meaning contraceptives are available, and you have to focus on rural outreach, especially in a country so spread out as Pakistan, especially in areas of Balochistan, northern areas, and the slums of many urban areas. Actually, I would have liked to talk about the urban-rural differentials. I will say quickly before I come to an end that urban-rural differentials was something I studied way back in the 1970s. There's hardly any difference. And there is about almost a child difference in fertility. But in terms of the differences in demand, overall demand and contraceptive use, frankly, it's not as stark as it is in other countries. So we have a kind of not such a stark difference. In ways, that's a good thing. We don't have huge inequities. The bad part is that the message it's uniformly stalled, that maybe having a closely sort of better spacing of children, fewer children are good for women's welfare, for women's health, for child welfare. That kind of campaign has certainly not reached. And services are definitely worse in rural areas, as I pointed out. So I will now conclude that basically Pakistan's divergent fertility decline in an already divergent region, as I pointed out, which similar levels of poverty cannot explain. I mean, there are higher levels of poverty in one or two of the countries. Religion, Bangladesh, Iran, you name it, and Saudi Arabia I pointed in. All Islamic countries, I think, women have gone ahead. Women's status could be still a big, but overall women's status is low in this region, and certain practices, at least, sex selective abortion and so on, have not reached Pakistan as acutely as they are prevalent in Nepal, India, and even parts of Bangladesh. In a paper that I did, John Castelline and I worked, he's in University of Ohio, worked a lot on unmet need and the prospects, and we wrote a paper back in 2001. And thanks to this seminar, I actually went back and read what we wrote. And we thought that the prospects of, because the 1990s were the golden era for Pakistan, and because we had the Lady Health Worker Program, we had social marketing, we had an intent on the part of government, open intent to do something post the Zia period. And we saw the decline from about a fertility rate of about 6 to about 4.5. But since then, it's been very slow. We predicted that there was a decline, slight decline in demand for femicides, and we thought that would continue. There would be a crystallization of, because it seemed like Pakistan was really on its way to development, etc. The couples would it would crystallize the smaller demand, and then there would be quick diffusion, because we are very mobile, and there was mass media that was coming in and so on. The second thing we assumed was that the LHW program would continue to operate and expand because it was such a good thing and got such good reviews. No, it dwindled away, and they moved into polio, and now they're not doing probably much of anything except occasional work for the government. And the scheme has been they're now part of the government, and they're not expanding, especially in Punjab. So I've already explained that the demand of children, contrary to expectation, remained the same. It's hardly changed. It's also uniformly not changed. It's not that in Karachi we're getting 2 desired family size of 2. It's still about closer to 3, I would say. And despite all this, Pakistani women still have relatively high unmet need for family planning. Around, it was used to be about 25. It's come down to 18. It's amongst the highest in South Asia, but that's affirming that family planning services are simply unavailable, because even the ones who are all ready to do something, so, and I think the large number of abortions confirms that women, Pakistani women, are really resorting to abortions instead of family planning. And in health terms, in cost terms, this is a huge cost to society, huge cost to women's health. And not because, I mean, an abortion is a much more difficult thing to go through than to preempt unwanted pregnancies. And the rising age of marriage, these are both anomalous in the context of unchanging mindsets. I think basically socially, I don't think we've progressed that much. So to conclude, I would say that I haven't gone very far in my explanations, but I hope to, we hope to, John Bongas and I are really struggling to come up with some explanation for what's happening in 2021. But I think at the moment, I would say that it's really institutional societal factors that favor a high demand, a higher demand for children, while individual women and even men really would want fewer children. And they do it, these two sort of things are at odds, and I won't go into details of policy, like there's a National Finance Commission award which favors high fertility rates, and then we're saying we want lower fertility. So there's a conflict here, and I think particularly the position of women is weak to implement desires or even voice them sometimes. But in an individual interview, I think I'd never have met a woman who say, I'm really happy having these 4, 3, 4, 5. Nobody really has come up and said that. And this is not that I'm doing the interviews, but we hear the interviews that my colleagues are doing at the Population Council and at National Institute of Population Studies. And the weak implementation of policy, we may have, I mean, I've never seen such a paper thin, I would call it, policy that never filters down, especially after 2002, that in ways we had an official policy. And that's when I think we failed to implement. And I hope that that won't happen to the CCI decisions, where there's a roadmap and all provinces in the Federation are following a kind of roadmap for lower fertility by 2025 to about 2.9 and 2.1 by 2030. Very ambitious. So I'll stop here. Thank you very much for listening. And I'm ready, for whatever questions you throw my way. Thank you.
Thank you so much, Dr. Zeba, for that very fascinating talk. And so there's several very important points that we would want to touch into and talk to you more about. But I'm going to start with the top line concern. So you've spoken about policy and you've spoken about the targets. But in spite of this huge divergence and in spite of these very stark trends, the conversation about population and policy around controlling population and is missing at the national level. And so this is also something you've written about recently, about the missing threat. And so how do you think we can make this debate and this policy concern salient again, not only at the provincial level, but also at the national level, so that it becomes the center and focus of debates, especially when we are planning for all other indicators in all other sectors?
Thank you, Maha. I think it is really at the heart of these CCI decisions was very much a demographic target, as I named 2.9 by 2025 and a lower population growth rate and so on, and concern for the intercensal high growth rate of the census in 2017. But underlying our analysis is one of the failures, and I can link it to policy, was a very vigorous policy followed in the 50s and about population control. That now is really declared as not null and void, in the sense that we do not want to talk about population control because it was a top-down policy. Control implies I know exactly what you should be doing in your life and I want to control it. And for the religious elements and conservative elements within Pakistan, it also do bache achhe implied that we just want you to stop at 2 because it's good for our macro level indicators, not because maybe 2 or under 4 children or whatever number you want to have should be healthy children or mothers should be healthy. So the reframed narrative at the moment was number one task of these CCI recommended decisions, plan, whatever. And we are now proposing and now propagating a balance between resources So resources and size, I mean, of family, it's the parental responsibility to decide when to have children, how many to have, but with the proviso that they will fulfill their responsibilities and the rights of each child for education, health, etc. Similarly, the state does not have the responsibility to decide how many children. So control is out, but it does have the responsibility to help families achieve the family size that they want, to provide them with services, information, etc. So in ways, it is really tackling both the demand side and supply side, and you will get a divergence. And then, but it is a difficult concept to to convey. We're trying to get this through mass media, through social media, especially to younger audiences, because there was a backlash to do bache achhe and to the word control, because it also implies almost like the Chinese model. We have to emphasize voluntary family planning as a way forward. So I hope I can answer your question that way. Oh, missing from the dialogue? Yeah, absolutely missing from the dialogue. I mean, the most obvious dialogue it's missing is the dialogue about the economic side of things. I think, and on that particular occasion, when I wrote about the missing thread, I'm also part of the climate, a small group that was advising the National Security Advisor on climate change security. And they asked me, invited me in, and I gave the recommendation on population and particularly urbanization as an issue, regional inequalities as a result of climate change, but exacerbated by rapid population growth rate. So it's not just missing within the population world, there was ambivalence and maybe we were held back, but in larger circles, I was told when I said, well, why didn't you, when you had a list of threats, you had climate change, but you didn't have rapid population growth. And they said, well, we can't really fit in everything. And it's therefore, I would say the highest level, not a priority still, sadly. So not in economic circles, and even amongst health professionals, doctors, the gurus, who lead public health, they mention family planning, but like after a lot of things, not realizing it's directly related to reducing maternal mortality, child mortality, all the indicators before us. So that's how we can get traction, by working cross sectors, actually. So maybe that's a long answer to your questions.
Thank you, Dr. Zeba, and thank you for that fantastic presentation. I really enjoyed particularly the history that you laid out for us. And I was wondering if we could unpack that history of family planning a little bit. I mean, you've talked about the bache hi achhe. We know about we saw that shift to the Zeba program. I mean, from my childhood, I remember that those bache hi achhe slogan so well. And when that shift happened to the Zeba program, it brings me back to that slide that you showed us about women's autonomy. Because for me, the do bache hi achhe, as controversial that it was, as much as the pushback was coming from the conservative elements, it was a programming that was aimed at everyone, both men and women in society more broadly. But when you start shifting towards reproductive health, women are doing. And when you put that against women's status and decision-making position in Pakistan, getting society on board was just us setting ourselves up for failure, that we wouldn't be able to reach the levels of fertility that we're hoping for through this shift.
Yes, absolutely, Hadia. I think, again, great question. I think in ways you've answered it. I absolutely think it was an error. I mean, there have been so many strategic errors. I know do bache achhe sounds good, magar bachon mein waqfa acha bhi, would have been really a good one, because, that would have been admissible, permissible within Islam. It coincides with, you won't have a religious backlash, and because of the fear of religious backlash, mostly imagined, is the fear for not implementing population, or even for major leaders to come out and publicly hold events as they did in Bangladesh, etc. But back to your major question, the second error, I think I totally agree with you. You give a huge responsibility to the person who has the lower status in that house also, because by the time she's, yes, older women, we've related autonomy to age, and it's really positive. I mean, by the time you're 45, you've had 5 kids, you've been married for about 25 years, yeah, your status rises, the children have been born, they've been conceived, you're making decisions now under duress, and many of these abortions are taking place under duress. You think that a woman with her 5th unwanted pregnancy wants to go and get an abortion? I think most women would not. So, and then you give this responsibility, not just in terms of a decision to be made, but services. To date, we are arguing for services to be opened up for men. Incidentally, all our work around men is very, very positive. That was a catch up, and that I would say that's a positive change. Couples have converged. I'm not sure about the rest of the family, but they have lost the power in that decision making, except in certain maybe tribal areas, etc., or very, very remote parts of the country. Generally in urban areas, but even in rural, it's a couple that's deciding. But when the man wants to make, let's say, the couple wants to make a decision, what are their choices? Sterilization, IUD, implants are available to women. The only method available, and you mentioned Zeba Sathar, thanks to social marketing, it's widely available are condoms. And the condom use and withdrawal use are the 2 leading methods in Pakistan. They're being used very, very highly. I think after maybe sterilization, or even sterilization followed by the wayside, it's condoms, withdrawal, something like that. So men are making decisions, but they have very few avenues. So if they want to make a decision regarding health and side effects, there is literally, apart from the few high-end private sector providers, very few avenues for them to get that information. There are no informational campaigns. Men have very few avenues of talk about their own, their own marriage. That's really a no-no. But they can talk amongst themselves, and they only mainly probably talk about condoms, etc. They don't know about other methods effective. So just places where men can be counseled would be a great avenue. I mean, it's just as I said in I think one of the TV interviews, the tragedy of all this is that family planning and family planning services and good campaigns are something that's much easier than maybe even polio eradication. And many things that we've done pretty successfully, like HIV/AIDS, I mean, to some extent we've kept it. So what a pity that we can't do this. But I think it has to be exactly what you said, widespread. You have to address, and we are trying to do this. You just don't see, we're talking to the mother, the woman. You're talking usually to the husband also, and maybe some other family member or even a religious leader. So I think we're moving in the right direction. We're not doing enough of it. I think we have the theory right finally, very late in life, but not late, but now I'm now working a lot on financing, and we find that the financing is so pathetic. We are spending like 40-50 cents per capita on family planning, public health, public sector spending on an issue so big. And so don't start me off on that. Bangladesh, I know in 2012, when we made the comparison, spending $2 per capita, so 4 times. So naturally they're serious, they have intent, they put the money. They do the programming, you get results. I mean, this is not an area to shift. Iran dealt with its religious right. So I think none of these issues, anyway, I don't think religion is an issue at all in Pakistan. We made it one, so.
Thank you so much. I think that was very, very helpful. But just picking up from what you've said about a closed shop for family planning advice, information, and services, I feel we need more of those services. I mean, so while the gap exists for men, but also for women, we don't have enough of both the private sector and the public sector offering enough services. Hence, how do we take these services at scale and how do we increase these services in the next 5 years?
Again, you guys either have read up more than I think, or you're very well informed. I would say that if I had to put my bets with this level of public financing, which is not likely to rise too much, we will lobby for it. But the number one thing is, you're absolutely right. Women aren't receiving those services. And the number one opportunity is when they go for other, to health clinics for other purposes, both in the public and private sector. At the moment, neither the public and especially the private sector is also not offering family planning. They may be offering abortions and delivery and a whole host of things, but they're not offering family planning services. So we find that the prevalence of private sector is huge. And it's a bit like the mushrooming of primary schools in the private sector about 10 years, 15 years ago. They suddenly came out of nowhere because there was a demand. Similarly, I think we are finding small sort of research, we're doing a kind of intervention with BIS in Rahimia Khan with BIS beneficiaries and the Punjab Population Innovation Fund, that for the poorest women, given a voucher for travel, which, as I mentioned, large distances to travel and finding an authentic reason to go out, and introducing private sector providers, within 4 months in Rahimia Khan, pretty conservative area, 22,000 BIS beneficiaries have availed family planning, counseling, and services because it just opened up. It was just, we didn't expect that sort of response. So you're absolutely right. You make the opportunities, you do it, you seek family planning under the radar screen. It should be over the radar screen in the sense that it should be part of an overall health package. When you're seeing your private, even your paramedic on some women's issues, it should be part of those women's issues. It should not be such a, I mean, it's a health intervention, better space leads to better of the CCI that I keep talking about. But even if the private sector, we are trying to work so they get some contraceptives because they don't get free contraceptives. Public health gets, public population welfare program has a free contraceptives. If private sector providers can get free or subsidized contraceptives, you'll see, I mean, I just want to throw another statistic about women's health. Doubled in 10 years time from 2007 to 2017. Something that also requires a behavior shift, not to deliver at home, to deliver. And now the norm is to deliver in an institution. So I think use of family planning can quickly go through that tipping point and there'll be an eclectic rise, but that hasn't happened. And it's not going to be automatic. It does require, serious policy inputs, or at least financial inputs. Thanks.
Thank you, Dr. Zeba. So I know you've already talked about Bangladesh a little bit, but I'm curious, what are the lessons that you think that we could learn from the Bangladesh experience? What is it that we could effectively implement in Pakistan to reduce our fertility rates?
Yes, I think that at the highest level, let me start with the highest level. I initially thought this was not that important, but it appears it is important for the head of the state or the head of the province, etc., to make this a priority, because that's how we work. It filters down. If the chief minister cares about polio, how do you think we managed to tackle polio? It went from top to bottom. It was a good structural arrangement that even I know we haven't eliminated polio, and there's a team right now, and there's still, but there are only 2 polio cases. So we're doing a lot of things right. So the head of state, there has to be a lack of ambivalence. You can't have things like, you know, I won't name them, but provincial governments celebrating when they receive the results of the census because they're going to get a bigger award, and others commiserating Punjab because they're getting a smaller share. It sort of encourages, or who's going to go out and say, no, actually we need to reduce family, population growth rate to improve our health, and nobody's going to really. So there has to be a public statement that this is a health initiative we are introducing because we care about saving our mothers and children, if that's the one you want with the least resistance. And that message will deliver family planning services. They'll add it to their repertoire, and they're like, if there are maybe 15,000, 18,000 public health and population outlets, I would say there are 5 times that number of private outlets that would be able to see immediately that expansion of services. The third, or maybe I would have placed as a high priority, is community outreach. Bangladesh expect, and again, women in Bangladesh in the 80s and 90s were, as Maha pointed out, have we given women a big responsibility? But Bangladeshi women, no, we have this image of all of them marching to the garment factories. No, the majority are at home. They do probably work, but they live in similar conditions to Pakistani, maybe sometimes in greater abject poverty. But the program reached them. They didn't have to go out, at least initially for about 10 years, this vigorous community outreach. Then fourth would be the involvement of the clergy right from the beginning, nullifying their concerns, involving them. So the classic story that I love to tell is told to us by a participant at a seminar I attended a few years ago, that every couple of weeks is an announcement from the mosque that every day there may be, there was a particular Maulvi who used to make an announcement of it's evening and have you taken your pill sort of thing. And otherwise, the more common thing was announcement that there's a family planning mobile team coming. We could use mobile teams and make that announcement, give it that endorsement. We need greater endorsement at the community level. So especially of religious leaders who are the thought influencers and values. So, if they come in, and believe me, our work, we have worked extensively with high level religious leaders and then some with community level. It's a question of framing what you have. I myself, was apprehensive about this, that, but honestly, the argument fails because there are so many points in the Quran, so many Sunnah that really point towards birth spacing, health of the mothers and children. I mean, you said that saving, he keeps repeating that. You've taught me that saving one woman's life, one person's life is saving humanity. Well, I would like to save the life of I don't know how many mothers. So, if you get those statements, get them on TV, the choice.
Mentioned some very important points, but at the heart of that lies communicating information in a way that can be trusted, whether that's through imams or that's through, and the framing that you said is important. But once you're talking about the question of population and framing. And you also mentioned the census, then data is very, very important, a very long time, and then we release, and so an instrument. And how can we make use of more innovative methods? How can we have the communication campaign and anything to form the framing around this very important policy concern?
Well, there are multiple layers of answers to your very multiple layered question. If we talk about the census, actually I'm missing the 5th planning meeting. It's happening right now. While we await the results fully to be released, they are still not released right down to the tehsil level. The results that are released now were actually provisionally released in 2017. And you're absolutely right. So I've actually written a note. I can share that with you since you seem interested in the census, since I wasn't going to be there. A background note as saying that the first thing we should do is improve the communications around the forthcoming census, if there's going to be one next year. So make it, I mean, it's like the fan planning thing. It's anything, you know, that you have to make it sound like we're doing a census, and it is a census for people. We need to count every breathing person who's breathing the air of Pakistan, because we need to plan for them. We need to know how old they are, how many men, women, and where they're located. That's why we do a census. But quite honestly, even in this committee, and the reason why we are having a census, not entirely, but I think pretty much driven, and the political debate is around seats in the parliament, share in NFC. That's what I mean. It's such a disconnect between the macro conversation, which goes astray, and not getting that voice about why we're concerned about people. So that's regarding the census. And so the data being released late is a real disadvantage. But I tell you that there are other data sets, and we've got plenty of them to weave enough of a story. And I think the demographic health survey is done regularly by National Institute of Population Studies. This last one brought in the whole module on gender. And now the PSLMS, I think that's a Living Standards Survey, 1920, that's a wealth of data. But I think what we do need is more frequent data and rapid release, because it's too important an issue to be left, and disaggregated data, because this is a large country. And sometimes we can't do our analysis. That's where your census, the census becomes very important, because we need to know, are we studying the population wrongly? Are we weighting our surveys differently? I mean, are we more, an issue that we had of earlier discussion a couple of months ago, are we more urbanized because we're using outdated definitions, administrative definitions of, and if so, we're missing the ball. I mean, in terms of planning and that balance. I come back to the narrative. How can a state create a balance between resources and population? Because they're doing it on the basis of an outdated number, like you said, it's 18, 19 years old, and also not agreed upon. This is the mean allocation, the NFC. But even within provinces, how do we allocate across districts, sub-districts? You know, how are we going to distribute the provincial awards? How are we going to distribute provincial budgets? So, and how are we going to ensure that every person has a right in Pakistan to get the same level of resources? I think a topic we haven't addressed here is large inequities in Pakistan. And I do hope in subsequent lectures, I'm sure you have people who are really, I think my biggest fear is all these problems that are falling by the wayside are really leading to inequalities that would be difficult to address as we go along. They're really, really surmounting. I mean, they're growing, they're not diminishing. One of the equalizers could be, you know, something like good health services, good education, etc. which
Shandana Khan Mohammad found the South Asia comparison really eye-opening, and she said that as a key, so we haven't clearly thought of this as a key service despite its impact on the population and the economy. So what is the political will for putting it back on the policy agenda? What policy opportunities or windows exist?
Very good question, and I think I've been touching on it. Honestly, I think that I feel failed. I feel we've been failed more so by economists than any other group, because in terms of who's listened to, I mean, in terms of the voice, the weight, let's say the economic advisory group that advises the Prime Minister, there are a couple of people who feel very passionately and they say we are your champions, etc. I don't think the conversation happens. And I think that if we weave it, see, at the secondary level, we can weave it into our health conversations. But in order to extract the resources, for instance, I'll give you the example. So that, again, a CCI decision, and I'd be happy to share electronically these CCI decisions. So you can share them with whoever attended. I think it would 10 billion annual fund, non-lapsable, that would be allocated for something that was so important. And we explained exactly how much it would cost, who would do what, etc. We're still lobbying for this budget and still hopeful, though I have given up hope, that at least part of that would be released. Rupees 2 billion would be released. So there's no, to answer Shandana's question as such, the voice is too muted. And I think that combining, and that's what we hope to do with some project that we're actually really writing up. We need some assistance in this, that to know that in private conversations they all agree, but we need some strong analysis. Love to work with people like Shandana, yourselves, and Dr. Chima knows I'm always reaching out to him for support. Dr. Ijaz Nabi is a real champion, and it took him a while to convince, but I think he is fully convinced now. So there are some handful of economists, I would say, Dr. Hafiz Pasha in his book, really, but that has not got traction with the current government, at least. I think with the previous government, I don't want to compare and get into that, but I think it takes time, and it's hard work, but it's who has got the ear of the chief ministers, the Prime Minister, the economic advisor, and the deputy chairman planning is a very strong supporter as well. But then we worked with him a long time ago and showed him all this evidence. So I think we failed, but I think we haven't failed entirely. I think we have to operate in a partnership. I think that's what we plan to do with some leading economists, with some updated analysis, etc. So I hope Shandana will, I have a lot of respect for her work, and I hope that she'll join that team too.
Thank you, Dr. Zeba. And so just building upon from that, so we've spoken about policy, we've spoken about the supply side constraints, but let's also talk a bit about the demand side constraints. What are the key demand side constraints? And within that, and within the attitudes in Pakistan, has there been an intergenerational shift in both men and women and their attitudes?
Another great question, and I absolutely think that's going to be the tough one. I think that shift has happened, and we've got evidence, mainly qualitative, of that shift, but some quantitative as well through the DHS. On the other hand, I think it's if you were to think about living conditions, living arrangements. Sorry, we thought that we saw the beginnings of in household surveys, and this would be an interesting topic for younger researchers like you to take up, shifts towards nuclear households and therefore more nucleated decision making. But we find that I think it was the last analysis that actually Maqsood did for me, that actually the number of and the proportion of nuclear households is actually diminished. Traditional, the extended households went up. Of course, this is based on how we collect the data, how we define households, etc. But imagine if there is a built-in household child support. Let's just compare two families. So a whole theory was based on that, incidentally called Caldwell's theory of fertility, explaining fertility decline, and was put into Africa. But if you're really having the next generation, because the first generation is still around, they're making the decisions, the wealth flows are from the old to the young. You don't have to look for a job. You don't have to set up your own house. In fact, we want you to live with us. You're not really doing the calculus of how you will deal with 5 children or 4 children or 3 children. You're very careful. It is happening in urban areas in Pakistan. But as I pointed out, what's disappointing is an exercise that we did just, I think, a few weeks ago, based on the DHS, replacement fertility, which is so prevalent in 2 children or so, 2 children, so common in the rest of South Asia. We haven't even reached that level in Karachi or any urban area. I think urban Punjab is like 2.4, something like that, or even 2.6. So even in urban areas in Pakistan, we're not seeing that shift. I hope that I've framed your question, but it has to do with intergenerational. So the decision making about children still remains mainly within the couple, but even in rural areas, etc. But it's the influence, it's the influence, the demand side, as you said, and you don't need to plan as stringently or think out your decision so stringently. You might enjoy really. In the West, the responsibility to some extent is shouldered by the state. Here we know the state is not going to come in, especially for education, etc. So the minimal education probably you can get in a rural area. But now more and more couples are thinking about the future of their children. And I always argue that I think most people want a better life for the next generation than they had themselves. But if they genuinely feel that a large, happy family is better, then they will promote it. I think it's that conflict hasn't really occurred, but it will under duress. And I think the duress comes from unexpected directions: COVID, health crises, economic crises, food crises, and they're happening. We have evidence of that. So.
Thank you, Dr. Zeba. Thank you for the time that you've given to us today, your wonderful presentation, as well as your generosity in just answering so many questions that we posed at you. By the way, I would love to work with you. So anytime you want to, I would be more than happy to work with you and the great team that you have.
Thank you very much. Thank you.
So we'd like to conclude.
Thank you for all your great questions. Yeah.
No, thank you. And we hope to host you again and listen to further discussions of the many fascinating points that you raised today.
Thanks a lot. Look forward to seeing you.
Thank you so much for joining us.
Thank you. Thank you.